Hello guys, Happy New Year. We are going to go ahead and change out Mia's tube. We're going to let you guys go through this process with us. She doesn't like it a lot, so she is going to get a little fussy, I'm sure. Or maybe not. Sometimes she acts like she's kind of used to it at this point. But we're going to go ahead and show how we change out her NG tube, how we replace it. Remember, the NG tube is how we administer her medications as well as her milk feeds. So this tube is going to go in through her nostril and down into her stomach. And then we're going to go ahead and give her the meds. So let's get started. Okay, go ahead and remove the old one. So what I'm doing now is just removing the tape that we use to keep the tube down. This probably is the part that she dislikes the most, because even though the tape is specifically for the skin, it still irritates her coming off. Okay, so we got the tape off the skin. Now I'm just going to pull the tube directly out of her nostril. That's coming out of her stomach and out of her nostril. There we go. So this just literally came out of Mia's stomach.
And we have to put a new one back in. You can clean her later. We're going to do the other side.
Okay. We're going to go ahead and put it on the other side. In her other nostril, just to kind of give that nostril a break. And I know it's kind of hard to see, but I'm gonna try to keep her steady while Felix attempts to get the tube down. Okay, Mama. I know.
There you go. It's okay, boo.
I know, Mama. Almost done. Almost. Yeah. Yeah.
Okay. Right there.
Got it. And I know we are making this look easy, but this used to be so much more difficult for us when she first came out of the hospital, because she was smaller, of course, and it was harder to get her to stay still, to get her to, get used to that feeling of having something go down her nose. I know you guys know how uncomfortable that is when you get something in your nose. Just imagine having to have something shoved up your nose, down your windpipe and all the way down into your stomach. So she's definitely a little trooper. So she has the new tube in. And what we're going to do now with the stethoscope is check for placement. We're going to make sure that the tube is actually in her stomach and not in her lungs. And this is very important, because if the tube gets into her lungs and we're, feeding milk down the tube, the milk will go into her lungs rather than into her stomach. And in that case, she can aspirate, meaning, she can choke, and it can cause, a lot of problems that we don't want. So what we're going to do is take this syringe is empty. We just pushed a little bit of air into it. So we're going to put it into the tube while he puts the end of the syringe down here where her stomach is. I'm going to push the air into the tube. Felix has the stethoscope in his ears.
Good.
Okay, so there's a sound that he has to hear the sound will come through the stethoscope to let him know that that air was being pushed into her stomach. The way it sounds when it's being pushed into her stomach is different than the way it sounds when it's going into her lungs. So what we're going to do now is pull that air out that we just pushed into her stomach, because that can actually cause gas when she has excess air in her stomach. So we pull that air back out, and voila.
Now we can apply the medicine.
I'm just going to button her back up, and then all we have to do is go ahead and give her medications through the tube. These are just the medications that we that you watched us draw up earlier. Now we're going to go ahead and give her the needle injection. Well, we usually give it to her in her thigh.
I'm right in the bottom of it.
Alcohol pad. So I've already cleaned the injection site. I know, baby, I know. All done, okay? All done. So like I was saying in the other video, I don't want to hear any of you mothers complaining about having to change Pampers or make bottles because, you know, it could be a lot more serious, you know.
Yes, it
This
can.
is not something that you know, that Felix and I caused, you know, Mia to have. It's one of those things that could happen to anybody. It's a very rare condition, and a lot of babies who don't have a brain condition, they may have some other sort of ailment, and they can still have to have an NG tube. So it's actually a very common medical need, having an NG tube. They really are not supposed to have it too long. Generally, doctors like to get rid of NG tubes somewhere between 3 and 4 months. However, we've been working in therapy with Mia to try to get her to swallow and mouth feed on her own, but things are taking a little bit longer than expected, and we just kind of want to delay that so that she doesn't have to have a tube surgically implanted into her stomach, because then, you know, that'll be a lot more work and she'll have to go through a procedure that we don't want her to have to go through. So, well, again, Happy New Year's, guys, and thanks again for all of your love and support on the page. We'll be coming back with more videos, and we just want to offer our support to other families who are dealing with holoprosencephaly. If you have questions, if you just need advice or someone to talk to, we're definitely here, and we don't mind being a sounding board and giving you guys whatever support we can.
Anytime.
All right. Bye-bye.
Bye. Happy New Year.